Good afternoon. Thank you for joining us for our Move the Needle call today. My name is Judy. I'm the Circle Membership Director for the Policy Circle, which means I'm here to support Circle leaders as they bring these conversations to the local level, which is a game changer for impacting hearts and minds. So thank you, all of the Circle leaders on the call, for servicing this mission with us. And thank you to everybody that's participating today for your future and your past generous financial support of the Policy Circle. I'm going to just go over a few things to make the call go a little bit smoother. We are recording this conversation. Please turn off your notifications on your computer or your phone by accessing your network preferences or your settings. If you would like to ask a question during Q&A, then you can use the raise hand feature, which is located at the bottom of your viewing screen. If you would like me to read your question, then you can use the Q&A function as well. We already have 4 pre-submitted questions from a Circle leader, Lauren, a Circle leader, Jasmina, and Irma and Della. So I'm going to call on you gals first and give you the option to use your camera so we'd be able to see you while you ask your question. One last thing. Sylvia is going to ask you at the end of the call what really resonated with you. So she's going to ask for you to submit one word or a short sentence in the chat box. And we would love to hear what it is that was, as you're participating, what was really resonating with your soul as you were listening. So I'd love to turn it over to the CEO and co-founder of the Policy Circle, Sylvie Legere.
Hi, thank you, Judy, and thank you everyone for joining this Policy Circle webinar. This is an opportunity for us to bring together Policy Circle members, friends, supporters, and nationwide. We now have about 323 circles in 40 states. So it's exciting to be able to bring together a network. Our mission is really to inform and inspire us to engage in a constructive manner with our government at the local, at the state level, at the national level. And then so our mission here is to provide you with information and language to be able to engage constructively. So the conversation today is around governance and private-public partnerships. So I'm really excited with our panelists who will be joining, Betsy Atkins, Elaine Duke, and Karla Jones. Welcome. So what I'm going to do is give an introduction of who they are, and then I have a few questions for each of you, and then we'll be able to kind of go back and forth, and then open it to the audience for some questions, as Judy stated. So first, Betsy. Welcome, Betsy.
Delighted to be with you all.
Thank you. Betsy is a 3-time CEO and a serial entrepreneur and founder of Baja Corporation. She's co-founded enterprise software companies in multiple industries, including energy, healthcare, and networking. And she's an expert at scaling companies through hypergrowth and leading them to a successful IPO. And I think notably, you led an IPO, an acquisition of Clear Standards by SAP, and which was purchased by SAP and Ascend Communications, and then by Lucent Technology for $23 billion. And at Baja Corporation, Betsy built 3 early stage funds that made investment in companies such as Yahoo, eBay, and Selectica. And you're a corporate board governance expert, and with an eye on making corporate boards really a competitive asset of companies. And I know you are also an advocate for women on boards, and you recently published a book that I highly recommend that's called Board Ready. And so highly recommend everyone to read the book and make it part of your career journey. So Betsy, thank you for joining us today. Also, I'd like to introduce Elaine Duke. Elaine, do you want to wave here? And so Elaine, and I have to call you Honorable Elaine Duke, is a specialist executive for Deloitte. And you are serving in the defense, security, and justice sector. And the reason for that is that you culminated your federal career by serving as a state-confirmed Deputy Secretary of the Department of Homeland Security from April 2017 to 2018. And during that time, you became the acting secretary for over 4 months, and you overseeing, during the most devastating hurricane season in our country. So you headed the responses to Hurricane Harvey, Irma, Maria, while also leading law enforcement, border security, transportation security, presidential protection, cyber, immigration services, and enforcement missions of the Department of Homeland Security, as well as serving as the Secretary for the United States Coast Guard. So just what that entails, the Department of Homeland Security, you essentially were the chief operating officer of that department that has 240,000 employees, budget of $42 billion, and 8 operating components. So thank you so much for joining us.
Thank you for having me. I'm
We'll be
looking
providing
forward to this.
the real private perspective. Elaine, one of the largest agencies in federal government. And now I'd like to introduce Karla Jones, who is actually in DC. You are Senior Director for the American Legislative Exchange Council, and you are directing a task force on international relations, as well as a task force on federalism. And under that task force on federalism, you spearheaded work in the states on a wide array of state sovereignty issues, including the transfer of select federal lands and to state control. So you'll bring that state perspective, and your organization is a member organization that includes state legislators, businesses, nonprofits that come to the table and discuss and define state policies that can be implemented. And then so you also work hard at educating your members as to how the states are stakeholders in issues that are being discussed federally and also internationally. So we thought we have all 3 perspectives here for this conversation on governance as well as private-public partnership. So thank you, Karla, for joining us.
Thank you for inviting me.
Yeah, so thank you. So I'm going to first really start with Betsy. And Betsy, love to ask you to talk a little bit about governance, corporate governance, in a time like this. What are the terms of board engagement in a time of crisis that we are right now? And what is the focus?
I'm delighted, first of all, to be with you all. And I've served on a variety of public boards, 34 of them. And I'll share a little bit from the view of both Volvo and particularly Wynn Resorts, where I'm currently a director. So in the time of this crisis, what we've done at Wynn, which I think is interesting as a partnership between the public sector and the private sector, we have looked to identify what we could do as a corporation to work to get Nevada and Las Vegas back open in an orderly, phased way that would be safe. And so the first thing we did was in early January, because Wynn has a big footprint in Macau, which is right near Hong Kong, they got sick, and we went and furloughed all of our employees with full pay in Macau in January. So we had a little advance warning. And the learnings that we used were we immediately hired in January to get the moral authority and the knowledge, a representative from Johns Hopkins Epidemiology, Dr. Katz. And she, with our CEO, engaged with the hospitals and the university research facilities and developed together with the medical organizations a set of benchmarks that from a healthcare point of view, they felt were safe. And we developed the benchmarks together and then went to the state of Nevada. And our CEO was asked to go meet with President Trump and at the federal level, they liked the 23-page plan that we had created for phased opening so well that they've asked our CEO at WIN to work with other governors. And by having here are some specifics that show the interaction between the public, whether state and federal, and then a private company. What we've done on just basic tactics, like doing testing where we can't get enough testing, and Wynn Resorts has 15,000 employees, and nobody's going to go back to any hospitality place unless you know the people serving you are safe and the people cleaning the rooms. So we organized with the university med school and the local hospitals to do testing of 15,000 people in our ballroom. And of course, the municipal and state representatives and county people all had to be okay with it. And then the testing kits were so expensive, $100 each, 15,000 people, it's a lot. We looked at what they were doing in Korea. And because we have an Asia footprint in Macau, we brought in those test kits that are $25 each. And of course, we're getting them in bulk, and we're working with the federal government to help bring in those test kits because they have very advanced test kits there. So that's a practical example of getting testing. And then the state of Nevada, Southern Nevada, doesn't want to open in a phased way until they have good tracing of who are the infected people, COVID tracing. And they couldn't really get their act together in the Southern Nevada district. So we gave 170 phone people, they're the people who take the reservations. So the call center people from WIN have been seconded for free over to the Southern Nevada Health District. They've been trained on the script to be able to do COVID tracing. So those are some examples of the kinds of things, if you're a private company and you want to do the proper support for your district and state and municipal and federal to have an orderly reopening of how you can build direct partnerships.
And as a board, Betsy, if you could touch on, as a board, these were activities led by your CEO. As a board and the board members, how did you structure kind of the priorities, right? In terms of you started off with how could we go back to business and reopen? And then did you have a structured approach in terms of employees, clients, how did you structure kind of your response and reaction and focus?
So it was the suggestion of the board to go and get a world-class epidemiology expert, because otherwise we're making decisions on things we don't know anything about. So we got Dr. Katz. She's the #3 at Johns Hopkins. She's advising the Pope and how the Vatican should reopen. So she's a very knowledgeable person. And that gave us credibility to work with the various hospitals and university research, med schools, and healthcare organizations in the government. We had some standing, and by working with them to develop benchmarks for our clients, our customers, we're going to do test kits. We brought we're implementing the CDC standards plus based on what we learned from China. So we're bringing in all the thermal sensors, all of the room sterilization and spacing guidelines, because if you don't do that, nobody's going to come back, or worse, they'll come back and people will get sick. And so you need to be sure your people are trained, that you've changed the way you're going to engage with the public, as well as with all of the public sector people.
Right. And your board is of course a national board, so you're able to leverage the board relationships with within those institutions as well as across the country to bring in the expertise and also share what your company is doing with other companies, right?
Yes, we were we have leveraged our relationships with a variety of, CEO of Kaiser Permanente and the Rand Corporation and UCLA Medical and a variety of East Coast prominent healthcare organizations, Johns Hopkins among many others. So we were able to do that. We were able to facilitate introductions at the various state levels and federal levels to help, for example, our CEO to be able to have access to the White House and share the 23-page plan, which President Trump felt was so worthy, he's using part of it now.
So it's great. Well, I'm going to turn it over to Elaine to talk about the Department of Homeland Security. Well, and Elaine, it would be great, if you explain. This is a unique time for the Department of Security, and because we've never been in this situation where the enemy is within, or is really pandemic, and we're learning as we go in a way. So explain, what is the role of DHS, and in particular in this crisis? If you could tell us a little bit about DHS just as a whole, because I think a lot of people expect DHS to be all the answers, right?
Yeah, many expect that. So DHS has a responsibility. First of all, it runs the 8 operating components that you talked about. Critical in this specific COVID are Transportation Security Administration, Customs and Border Protection, that are critical to reopening the country. And when DHS was stood up after 9/11, its principal role in a time like this is to coordinate national incidents, not command and control, but coordinate. Most of DHS's familiarity in this area is through FEMA, who is the lead for natural disasters. But DHS also has a coordinating role for any type of incidents. It's all hazard, all incidents, terrorist or man-made. In this, when DHS was stood up, there was quite a bit of discussion over what was its authorities. You had other existing departments like Health and Human Services, Department of Agriculture, Department of State that had existing authorities. And the decision was, when we set up DHS, that DHS would have this coordinating role, but that it would not take any statutory or regulatory authorities away from any other department. So it would be the convener. Because of that, we set up a national response framework. And the national response framework sets forth the major types of incidents that could happen in this country and who has lead and who has support roles across the federal sector. This particular incident is a health incident, and so it's Emergency Support Function 8. And at the end of this, the Policy Circle will provide you some links if you want to study more on any of this, if you're so inclined. But with ESF 8, that's the emergency, HHS, Health and Human Services, actually has the lead for the federal agency. And that's why quite a bit you'll see HHS on the screen with the president. Huge support role for DHS. In this particular incident, we, for the first time ever in a non-natural disaster, a non-flood hurricane, set up FEMA to run this because of the capacity, and HHS doesn't have something like the National Response Coordination Center that DHS has. So right now, housed in FEMA, we have the National Response Coordination, NRCC, operating. And what that basically is a huge space of many, many people on 12-hour shifts. And I say, I absolutely applaud what New York is doing for its first responders. Let me assure you that quite a few federal employees have been on 12 on, 12 off, 7 days a week since the start of this. And I want to take a personal moment to applaud them too for the work they're doing. But basically there's representatives from every one of the federal agencies on that floor so that we could give a coordinated response with a team of FEMA personnel, DHS, and in this case, HHS leading that and coordinating. So in a disaster like this, neither the lead HHS or the coordinator DHS takes over. It just coordinates. So the reason for all those people are on the floor, that if we need something from DOD, like air support, we needed to bring citizens back to the United States when this occurred. If we need to see if Defense Logistics Agencies has any of the personal protective equipment, everybody is right there on a single watch floor, and we can bring the full power of the federal government together. Interesting enough, on that same floor are liaisons to coordinate with not-for-profits, charities. American Red Cross has a permanent seat, and they serve as kind of the coordinators of that humanitarian piece of relief for any disaster, and also coordination with industry, because the federal government cannot do any response without industry support.
So that's really helpful. So thank you for this overview, because it's always a mystery and in the news. And it's our mission, really. It's to go beyond the headlines and give information like that, so you can understand when you're reading about what FEMA is doing and or not doing, you kind of understand whose responsibility it is. The other piece, it'd be great if you shared, the agency's relationship with the White House, with the House and the Senate, because I know there's different oversight committees, and it'd be good if you just gave us a little bit of a brief overview of that.
Okay. Well, Department of Homeland Security, the Secretary sits in the President's cabinet, and so serves both the Secretary and the Deputy are nominated by the President and confirmed by the Senate, and serve at the pleasure of the President, and really are his advisors on this incident. And you've seen Acting Secretary Chad Wolf from DHS occasionally on, along with Steve Mnuchin, who runs Treasury. Treasury has, obviously, because of the cost of this, a huge part. And so the President uses his cabinet to not only help shape his policy, but also deliver his policy. Any of you that have been to the White House, it's surprisingly how small the staff is for the President, because his outreach is through his cabinet and the power of those agencies. So that's a huge role right now, making sure that we can deliver. In this particular incident, you see DHS and Treasury together a lot because of the economic impacts of this. And DHS has a huge role in the economic recovery of our nation. Secretary Mnuchin is kind of printing the money, if you will, and helping distribute the money to key persons. DHS has a couple ways where it can help with not only the sanctions, for instance, holding China accountable for any role that might have of this through our customs and trade enforcement, but also through Transportation Security Administration and its private-public partnership with the airlines, the airport authorities, and the airport trade associations like AAA to help figure out a way to open the air travel so that we can start our economic revitalization. So the missions we support, I think, are huge triggers in appropriately reopening the economy when the medical advice dictates such. So very, very close coordination. Another area that is really big is our brand new CISA, Critical Infrastructure and Cybersecurity Agency. And they are responsible for cybersecurity at a federal level. But most importantly for this incident, they are responsible for coordinating the critical infrastructure sectors within our economy. And many of you probably saw the guidance that was put out by CISA on reopening, and that is done in collaboration. So CISA works with each of the critical infrastructure sectors about how they can protect themselves from a cyber standpoint and what type of standards should be implemented for reopening. CISA is not a regulatory agency. They're not like FAA and the airlines where they can regulate. They are a coordinating body and working closely with the critical infrastructure sectors. And another piece of this is that because the President declared a national disaster, that kicks in a law called the Stafford Act, and that allows the federal government to give public assistance for public purposes to the state, local, and tribal units. And I'm sure Karla will talk more about that, but the importance of that national disaster, even more important than an emergency declaration, is that it allows the flow of funding to those entities with a public purpose. In terms of our congressional work, that's really challenging in DHS. Most agencies or departments have 4 primary committees on the Hill overseeing them. 2 are authorizers and 2 are appropriators, 2 each in the Senate and 2 each in the House. And that is how DOD is. It is Department of Defense has 4 primary committees that it answers to. We have 4 primary committees, but because of the way DHS was stood up, pulling pieces of it from different agencies. For instance, U.S. Coast Guard used to be part of Department of Transportation. Secret Service used to be part of Treasury. No congressional committee wanted to cede any of its authority. So DHS answers to, depending on who's counting, between 93 and 97 congressional committees, in addition to its 4 primaries. So it's always a challenge to get momentum behind what our country needs.
And then you also have, there's, the relationship with the private sector. You touched on that, and I know, like you were a assistant director of a stakeholder engagement and lead of a Homeland Security Advisory Council. So for each of the agencies, there are like such councils where industries are represented and are consulted on what would be the best practices or the a course to take, right?
Yes, there's a federal law called FACA. It's the Federal Advisory and Council Act or something similar. That should be good enough for Googling. But it puts requirements, statutory requirements on secretaries that want to have industry counseling them. And it does that to make sure that it's regulated in a way. So if you want to have a body that is going to provide you independent advice, you set up one of these committees. It has a public portion to it. The records might be public, and that's part of the need for the federal government to be transparent. And so one of the links you'll see on the information you'll be provided is a link to the information about what FACA committees does DHS have. One is science, and one, it reports directly to the secretary. So if the secretary has questions, especially with this COVID, how can we fix these supply chain issues that we've had with getting personal protective equipment? How can we better engage the underrepresented communities like tribal nations, those type of things? He can go to that FACA that has leaders that are nominated and appointed to his, and get independent advice from prior federal leaders, from industry, and some of the best policy folks in the area. So that's a really important forum for him now, and I think he uses it. Acting Secretary Wolf is using that committee now, and you can read about that.
Great. Well, thank you. Thank you for sharing that. It's great to hear kind of what industry is doing in action on the forward negotiating, bringing together their expertise and also priorities in order to continue operations and employ people. And then to understand.
I'm sorry.
Oh yeah, no, go ahead.
One important thing I forgot is that DHS, and this is going to be important as you go forward with your groups, DHS is looking for innovative products that can combat COVID. And it has an announcement out right now that's accepting proposals from industry on a rolling basis for COVID commercial products that it may adopt in meeting its mission in COVID. And so that's another huge way that it's engaging industry. So my apologies for not mentioning that earlier.
Yeah. Thank you. Well, I'd like to turn it over to Karla to talk a little bit about, I know it varies from state to state, but one of the questions that we have and that industry has and is how can a state declare a state of emergency, and how do they set the goalpost to lift it? When is it? And I know that it varies very differently by state, but perhaps you could provide to our audience, where can they find out this information to fully understand this process? Because the business owners who operate in the state definitely have those questions.
Okay.
So, Karla.
State legislatures have legislation on the books that governors can use to invoke, that governors can invoke to declare a state of emergency. Usually that's done through executive order or a formal declaration. And these laws cover anything from just a general emergency declaration to public health ones. And a lot of them date back to the 1970s and even the 1940s. The states seem to have been enacting laws at the same time that the federal government was also enacting a whole lot of emergency powers laws. For the most part, the laws are very similar from state to state with some quirks. Like, for example, one state requires the governor to establish a committee that enables the governor to declare an emergency. Well, since the governor is establishing and selecting the members of the committee, that's sort of a pro forma committee, and a governor is never going to choose somebody that's going to deny her or him the authority to declare a state of emergency. One interesting wrinkle is Georgia and Oklahoma. They're the only two states that required the state legislature to affirm the governor's declaration of an emergency. But for the most part, the legislation is very similar, using even the same language. Like when I was looking at Montana's language in Pennsylvania, they have the exact same language that the courts are seizing on, that say that governors really do have broad and comprehensive powers when a state of emergency is declared. And like some of that language is, the emergency powers give the governor the authority to control ingress and egress to and from an incident or emergency or disaster area, the movement of persons within the area, and the occupancy of premises within the area. During a pandemic, the whole state is potentially an emergency or disaster area. And it's actually that text that's being used by the courts to uphold what the governors are doing in the states. Oregon is somewhat unique. They've updated their legislation recently, like in 2017, I think. And they just have a laundry list of things that the governors can do. But again, the governors have, when they've declared an emergency, the governors have very broad powers that have led a lot of people to think that they're engaging in gubernatorial overreach because they are so broad and ambiguous. And I think also public discontent with what some of the governors are doing is fueled by the fact that they've probably issued as many executive orders, emergency executive orders during this pandemic as they would normally issue during a term. In terms of lifting the emergency powers, that's usually done by the same mechanism, by executive order or proclamation by the governor. In 7 states, the legislatures need to approve any extension that the governor wants to make to her emergency powers. In 22 states, the legislature is actually allowed to nullify a governor's emergency declaration. I think Florida is one of those states. But 19 states lack limits entirely on what the governor can do and when the governor has to lift an order, an emergency order.
So thank you.
Is one of those states.
Yeah. So so thank you for sharing that. And then what are the, you know, and maybe Betsy, and before I turn it over, we're you know, before I turn it over to some of the questions, I'd love Betsy to maybe share how you see and how do you encourage your executives to participate in these forums, you know, at the state level. Clearly, WIN has done a lot working with the state government, but also at the federal level. I know you have some thoughts there, Betsy, and it'd be great to hear that, to hear those thoughts about how private industry, you know, how should they participate, or how do you view executive participating in these forums that that are set up for dialogue? Uh-oh.
Can you hear me? Okay.
Yeah.
Hi.
There you go.
You know, I always think it's interesting to look at an example. There is a supply chain software company named E2Open, and they're working with the state of Texas, and they can look by zip code, by small city, by every category of PPE, gloves, masks, ventilators, everything that you would want. And they can track who has what and where things are. And it's and this is a software company that does inventory management and has visibility right into the container level. What is on a container coming from what overseas destination? And they've done this with the state of Texas. So this would be an example that Elaine gave of them now going, now that I've heard her tell me that they can submit to DHS to say, hey, we have software, we're giving it to you for free. We're doing the services. We're putting this up in 6 hours. You can, they can ingest all the feeds from all the application interfaces of every piece of electronic information, every artifact, and tell you what you have and where. So I think there's a lot that the private sector can do and wants to give and donate. In terms of where to engage as CEOs and leaders in the various forums, you know, Sylvie is smiling because Elaine and I went back and forth. She was telling me about this great opportunity that, you know, leaders of companies could be on, you know, one of these organizations where policy is discussed. And I was very rude. And I said, I would not want my CEO spending a bunch of time doing this. My CEO needs to run the company, lead the company, make a profit. Their government relations person can, somebody from the board can, but that is, in the military term, not the highest and best use for them to be as a policy contributor. They need to, they're an executive that leads. So I think that there's a role for the private sector to engage. And I think in a time of crisis like this, you actually, if you're a private sector entity, you need to go and tactically solve these things yourself. I gave the example of WIN doing it with Southern Nevada, so they get to open. They're doing the contact tracing, and they're bringing tests in from Korea that are 1/4 the price, because you can't test 15,000 employees every couple of days, and then you're going to test all the guests and give them free test kits. You go broke testing. You know, you have to come up with a solution that is qualified, acceptable, and meets correct standards, but you need to go and find it yourself rather than be passive, or, you know, how much of your business just vaporizes as, you know, government finds their way.
Right. So, you know, I'd like to, yeah, right. And maybe Karla, you could talk about a little bit about, well, we're running out of time a little bit, so I'd love to open it up to some questions, because I know there's a lot of questions, and I know there's forums for businesses to participate, and I think like this situation really highlights how important it is for the innovations to come to the forefront to help government embrace new technologies and new ways of thinking and be innovative to tackle this the issues that is before us. So I'd like to, Judy, can we spend a few minutes turning it over to our participants with some of the questions that we have?
Sure. Lauren Hall is a circle leader from Indiana. Lauren, would you like to ask your question?
I'd love to. So thanks so much for all of your time, and grateful to be here. You've touched on this a little bit just in how you've described your roles and strategies, but I'm curious, what are essential operating norms or commitments for public-private partnerships to be successful?
Maybe Elaine, do you want to take that one?
Okay, sure. I think one of the essential norms is a feeling that we're uniting around the mission, in this case, recovering from COVID-19. So I think that most public, everybody knows in government service that companies have to make money. They're in business for a profit generally, and are somewhat ethical. But I think it's the big thing about uniting around this mission and the passion for making the country safer. And I think the second thing is planning. And I think that's something we should improve on. So it's not right to try to form these relationships effectively when the crisis is going on. And I think post 9/11, we did some great national level exercises with industry, and we've kind of slacked off a little bit. And I think kind of going through these types of things with our industry partners, so we kind of know the roles and responsibilities a little better. We're seeing that both with Karla's issue of federalism. We've kind of forgot what roles and responsibilities there are, and I think re-examining that would be really helpful.
Yeah, and I think I appreciate your point about the mission, because this is where it varies, right? In this case, and this is, I'm going to speak for Jasmine Hauser, who submitted a question. Under this, under Trump's strategy, the idea was that it would be, the response would be locally executed, state managed, and federally supported, and that needs to be. It works effectively if there is a common mission, and that's something that have you had a good. We don't have a lot of good experiences of defining a common mission that everyone really agrees on, especially in this case where there's health, but there's also the economic prosperity of all citizens. So the two are in dangers right now. So maybe Karla, you could comment a little bit around the operating norms or commitments for private-public partnerships, and also in this federalism, federalism that we are in.
Well, one thing, I totally agree with you on public-private partnerships in terms of mission and communication, and that the time to establish public-private partnerships is not during a crisis. And that's one of the goals that ALEC has, where we bring together our private sector and our public sector on a routine basis. And I think some of the governors might have benefited from a little more of that interaction with the private sector, like especially small businesses. They seem to have been just disproportionately hurt by the pandemic and by a lot of the rules that the governors made. And it seems to me that if a little more dialogue had taken place between legislators and governors and small business owners, you could have actually crafted policies that would have upheld social distancing requirements, but not completely gutted our small businesses.
small businesses, and I have to say, with the recent reports, it really impacts women, because a lot of the industries that are deemed as non-essential are leisure, hospitality, education, healthcare, all industries in which, between 50 and 75% of the workforce are women, and they're not necessarily at the table in when taking into account, when planning a reopening, or even issuing a blanket order of closure. So we have another question from Irma Lopez. Is Irma on the line? Irma, would you like to ask your question? Maybe not. I'll ask her a question. Her question is around the link between certification and the procurement process. There's procurement by the federal government is very complicated, and makes it very hard for businesses who are maybe innovating, or smaller, minority owned, cannot just be part of the procurement process. And I'm wondering, Elaine, if you could talk about that a little bit, because that's a key component of this private-public partnership. It goes from networking, from software to actual products.
Yeah, it really is a dichotomy when it comes to small businesses. The government's procurement system is set up to favor small businesses. In fact, there's a federal goal each year from the Small Business Administration, and near about 30% plus or minus of federal prime contracts are supposed to go to small businesses. So that is there. However, the complications of doing business with the government, the entry bar is so high, and that's the challenge of you get the same small businesses over and over again because they've kind of learned the trick. They've gotten the gouge. So I would recommend that small businesses that haven't done business with the government before, they reach out to the Small Business Administration. There's a lot of counselors. It probably won't work right now because they're busy with loans, but get with the Small Business Administration. They have counselors they'll assign you, help you with the business plan, help understand. Additionally, every department has an Office of Small and Disadvantaged Business. You can find it if you go to any website, like DHS is dhs.gov, and just search small business, it'll come there. And their sole job is to help you understand how to do procurement in the federal space. And the third thing I would recommend for you is look at getting federal type contracts under General Services Administration. So at gsa.gov, there's contracts that GSA awards that the whole federal government can buy from. They're kind of like the Walmart of government contracting, and that is an essential piece, especially if you're offering commercial technology or services. So you have to have two things. You have to have a product or service people want to buy, and a way for them to get to you, a way for them to find you, and GSA helps with that. So those are a couple tips. We could do hours on that alone. So
yeah, so that's a whole other topic. So we'll stop there. So I know that we're a little bit over time here, and I'd like to wrap it up. I'd like to, I'd love for everyone to actually take this time to put in your chat to all panelists, one word or a sentence that resonates with you and sums up what you got out of this panel and what you may be doing. So that way our intent is to try to create a word cloud of these expressions. And also, before we go, Karla, I would love your insights as to how can people in a state best influence the reopening of their states and share their innovations and ways of changing their operations, so it could be the rules of engagement can be safe and mitigate the propagation of the transmission of the virus. Do you have some thoughts there as to what would be, where should people look for a way of engaging with their state, with their governor, with the governor's office? Mm-hmm. All of the powers are lying with the governor right now.
Well, unfortunately, a lot of the things they're going to need to do are post-pandemic, like each state's emergency powers laws should probably require the legislature to approve extensions. I think governors need the flexibility to declare an emergency, but when emergencies are going on for 30, 60, 90 days, the legislature needs to be involved in that. Right now, protesting, but socially distanced, peaceful protests are probably a good idea. It kind of shines the spotlight on governors that are keeping economies closed longer than they should. A whole lot of states, people within states are filing suits. Like, for example, in my state of Maryland, pastors, state delegates, and small business owners have gotten together and filed a suit in a federal district court in Baltimore to reopen the state. And Pennsylvania also tried to file a suit. It went to their Supreme Court, was struck down, and then was ultimately struck down by the US Supreme Court.
So those are like really high, like extreme measures. I think. It's like, okay, I didn't expect that. So I think that there's also probably, I don't know if there's like social media channels to the governor's office, and through the associations could also be a way. I know sometimes even those people are not at the table because it's really the governor's office who are making the decisions. So that is something I think to really be aware of in the future, is that how can a response be structured in the future, and how can all stakeholders really be at the table when measures that we didn't think were possible to be put in place in our states are put in place. So thank you so much, everyone, for participating, and to our panel. I think this was incredibly informative. We have a poll here for our attendees to complete, tell us, so we can improve in the future. And I also wanted to, feel free to reach out to us and tell us about what your company, what you are doing to be part of the solution. You can send an email to communications@thepolicycircle.org, and also use our social media channels, Facebook, LinkedIn, Instagram. And I'd like to remind everyone, we're a grassroots 501c3 organization, and we depend on your support for organizing forums like this, for operating, for giving you the tools to also engage and continue the conversation in your own policy circles. So we invite you to not only invest in our organization and visit policycircle.org/invest, but also really host a virtual circle with your Policy Circle members. We visit the library, and we will be publishing shortly a brief on federalism. We have one on the Constitution, which we invite you to review to really understand the power of the states and all the agencies. So thank you very much, everyone, for joining. And thank you, Betsy, Elaine, and Karla, for participating. Really.
Thank you.